is on. On this New Year's Day, we mark yet again another milestone in our endeavor to provide healthcare services to our people. Last week, on the eve of Christmas Day, we signed the return to work formula with our doctors, who had just started their strike earlier in the week. And as in ceremony, it was a Christmas gift for our people, marking the birth of Christ. Today, we have witnessed the signing of another return to work formula with the officials of the Kenya Union of Clinical Officers. There cannot be a better New Year gift from our healthcare workers, and this time from the clinical officers. I thank you very much indeed, lady and gentlemen. This, as the Secretary General has said, comes after lengthy deliberations between the officials of the Ministry of Labor and Social Protection, of governors, and the union officials. The signing of this return to work formula marks the end of the strike by the clinical officers on the 7th of December. For avoidance of doubt, may I state that the government is committed to ensuring continuity of services to our people without disruption, and we will do everything possible to get all our striking workers back to work. As we battle COVID-19, we need all the hands on deck, as the disease is not showing any signs of relenting. As noted in the agreement here today, we are committed fully to the protection of our people, particularly their own health, via provision of PPEs, insurance covers for all healthcare staff. Indeed, we are committed to ensuring the welfare of our health workers. After all, they remain our frontline soldiers in this war against COVID-19. I wish to thank all the officials who have worked tirelessly to ensure this outcome of return to work for the clinical officers. We wish to encourage all the other healthcare workers on strike to hasten their stakeholders' negotiations to return to work as soon as possible. And as the Secretary General has just said, when you consider that our kids are going back to school within a couple of days, we really hope that it will be in an environment in which healthcare is not a negotiated issue, but a guaranteed issue for them. So let's not lose sight of the need to continue serving our people with diligence and commitment, particularly during this COVID-19 pandemic. I wish to thank all those healthcare workers, and I know there are many, who have continued to render their service to our people. This is as it should be, and I pray that God Almighty rewards you and your families with many blessings in the new year and always. As I take this opportunity to wish all healthcare workers and everybody a happy 2021, may I also remind Kenyans that disease is not defeated, and we need to remain vigilant in our adherence to containment measures. I would also like to add here, and the apologies from the Council of Governors, I did have a word with the Governor of Paranya this morning as I was coming, who is out of town, and CS Simon Chelugui, who is also out of town. And at the same time, as the unions have alluded, we do need to continue, even with the temporary workers that we had hired, because COVID-19 is still here with us. I would also like to announce and mention that at the same time, we have also extended the Interfaith Council. As you know, they were expiring this month in the month of December, and we have extended the existence of the Interfaith Council so that they can also continue to assist us for a period of another six months. So thank you all very much. I want to take this opportunity also to say a very special thank you to the members of the press. You have been here with us since day one. Some of you have been with us every day that we have made these announcements. We do not take your presence here for granted, We do not take what you do for granted. We know the role you have played in terms of ensuring that we communicate to the country, in terms of educating our people about COVID-19, and the work that you have been doing will be blessed by God. We thank you sincerely and honestly. Asanteni sana. Maybe I can take a question or two. But before I do so, let me also very quickly mention that today we have announced another 100 positive cases, 156 out of a sample size of 4,317. We have unfortunately also lost a bigger number than we have over the last couple of days. We have lost some 11 people today, and our condolences go to the families and friends of those who have departed. You'll get further details on that will be issued to you. But once again, asanteni sana. Thank you very much, union officials. I wish you well. I wish your members well. And indeed, I do wish Kenyans a very, very happy 2021.
Right, good morning. My name is Grace Kuria from KTN News. I have 3 questions. One about the other healthcare workers who are still on strike, and I'd like to specifically ask about the nurses, if there are any, ongoing talks with them, whether we are likely to see yet another, them here signing a return to work formula with you. 2, schools are set to reopen on the 4th of January. I don't know what plans you have in case there's any surge in the COVID-19 cases. Would there be a possibility and likely of, maybe closing the schools if cases continue rising? And lastly, we did see UK approve the Oxford AstraZeneca vaccine. I don't know what plans Kenya has. I know we have ordered for about 24 million doses of the vaccine, but if you could talk to us about the deployment plan of Kenya regarding the vaccine. Thank you.
Okay, thank you very much. One more.
My name is Kagwe from Citizen TV. And Grace Kuria asked one of the questions regarding the school reopening. Globally, we saw that in some countries that the reopening of schools led to a surge in the numbers, possibly ensure that this, even if it happens, that you're prepared to handle it. And then the second one, some of the measures that you had imposed, and even after the president's address, are lapsing this month. Are we seeing maybe the curfew and extension of the curfew, or what plans do you have for the restrictions that you had put in place?
Okay, thank you very much. I think that 2 things. First and foremost, it is the government will be issuing a report on all the measures that have been taken and possible continuity of it, probably before the end of, between today and tomorrow. Secondly, let me respond to the issue of, first, the issue of the nurses. There are ongoing discussions even as we speak. And my hope and prayer is that that can be concluded in the soonest possible time. I think it is important for me to state this for the record. It is in the interest of the government, and specifically in the interest of the Ministry of Health, that we have a happy working team. It's important for us. And not just happy doctors, not just happy clinic officers, but a happy Ministry of Health working team. And there is no team that can work effectively without the other team. Because you can't work without the lab technicians. Because if they are not testing and telling us who is positive and who is not, then the doctors you have no role. For every doctor, there is a number of nurses and clinicians who must work with one doctor. So a doctor cannot work without nurses and without the other team, and vice versa. Therefore, it's one seamless team. Here, we want to have a happy working team. Not just some members of the team, but everybody in the team. So we are going to engage with all of them, and perhaps this is the next new year. We'll be looking at new ways of working so that we do not resort to strikes on matters that could be very amicably agreed upon without necessarily industrial action on the matter. So just to state that from the outset. that everything is on the table and we are discussing with everybody. On the matter of schools, a lot has gone into in preparation of schools. I am aware that CS Magoha will also be issuing a statement on the preparations on the part of the Ministry of Health. We have issued protocols that relate to how we reopen schools, relate to how we operate during this time of COVID within the schools, including the protection of not just the children, but also the teachers as well. I think it is important to take note of the fact that the more exposed people, the more vulnerable groups are not actually the students, given the nature of the asymptomatic nature that we have experienced within our young people. But the more exposed people will actually be the teachers, particularly those who may be having underlying issues, those who may be of elderly. So we need to be aware of this and to make sure, and the teachers have been advised to take very serious, may take anything for granted. We don't want to lose any children and we don't want to lose any teachers. And as Grace, you have rightly said, there are very many countries that have opened schools and at the sign of an upsurge of cases have closed them. Many countries in the world have done that. You remember all the way from the first cases in Israel and other nations across the globe. And there is nothing that we have removed from the table. This is a fluid and dynamic situation, and we will be watching very, very carefully. We'll have officers moving around and observing to make sure that everybody is healthy. We'll be carrying out ad hoc tests, even in schools. We have provided and continue to support the Ministry of Education through provision of masks. As we open school this week, for example, we will be, through our own ministry, the masks that have been made by the Chamber of Commerce, about some 7.5 million of them, will be given to the deserving cases, those who cannot afford. But we have also made sure and told teachers and told parents that a mask is now part of the uniform. When you are sending your child to school with the school uniform, a mask is part of it. And ideally, 2 masks, reusable ones, so that they can be able to use one today, clean it in the evening, use another one the next day. But we will also support, the government will support to ensure that those who are not able are also supported with supply of masks. But let's not take any chances with that a particular issue. There are other protocols that have been issued, including how to operate sports, how to ensure there is social distancing. We have proposed that in our good weather, if indeed a class is too big and you cannot be able to social distance, it would even be better to do it outside than to do it inside. And I think the important thing here is to ensure that you take the measures that you deem necessary to ensure that the protocols that have been given are being adhered to, and that's critical. So that as we open schools, we do so protecting the school workers, protecting the teachers, and protecting the students. And I know that the Ministry of Education will be issuing further details and further statements on that matter. Vaccines, yes, indeed, you are right. We have ordered vaccines, and we have made it clear also, we have got the protocol that we are going to use to ensure that we start with the healthcare workers, because those are the first line. As soon as the first line workers, and the first line include even people like the police, the healthcare workers, the teachers who are in schools, students, and so on. So we have got a system which we have issued that to indicate who will be first to be offered the vaccines. And it is important for us to use that word, the operative term being offer, mandatory vaccination of anybody. It is people who will wish to do so. I think it is also important for me to mention, Grace, that even as we talk about the Oxford, the AstraZeneca vaccine, we are also negotiating with the others as well, including the Sinopharm in China. We are looking at the Pfizer's. We are looking at all the other vaccines that have been approved within the World Health Organization, so that we will not be relying only on one type of vaccine. The ideal thing to do is to use several so that you can increase also the chances of a higher efficacy, because we don't know the impact of either. But we are happy to say that Kenya has ordered the vaccines. Shantai, the issue of, again, you spoke to the issue of schools and reopening and what we intend to do. I think I've answered that question. If indeed we are going to be very, very vigilant, and we will be on the lookout to see any signs of increasing the cases. It is possible indeed that, as you know, the positivity rate, the whole of this week, we have had a very low positivity rate. And even if you look at today's rate, the figures that I have given you, 156 out of 4317, you can see it's just over 3%, which is a very good, rate. So it is possible that that rate might surge up a little bit. We will be watching to see to what extent it goes up. We pray that it doesn't. But the reality is that we can expect a bit of a surge in the month of January, and then possibly that slows down completely. So we are on the lookout, and what I can say and what I can promise parents across the country is that we are doing everything possible. Everything within the Ministry of Health is on standby for any size. We have also asked the county governments and the CECs for health in each county that the measures that we have taken within the counties, including the provision of facilities, the beds that we may have to make available, if indeed we get a surge in the country, that we do not relax any measures that we had taken earlier in the year at the point where we were closing the schools, so that we revise and we relook we have so that we can handle any eventuality. So we are ready, and hopefully with God's help we will be able to open schools safely. Thank you all very much indeed, and happy 2021. It is our, we have ordered. We are hoping that by the end of this month, second week of February, the vaccines will be here. Hopefully. Keep your finger crossed.